Good day, everyone. Today we'll be taking pharmacology. And our topic for today is receptors. The receptors that we have in on cells that are of importance in pharmacology and drug use. The first group we have here are the adrenergic receptors, sympathetics. So we have about five receptors under adrenergic receptors. First we have here is alpha 1. The alpha 1 receptor, its main function is vasoconstriction, which is to cause the constriction of the smooth muscles in the blood vessels. So by causing constriction of the smooth muscles in the blood vessels, it can lead to increased blood pressure, like I wrote there, increased BP. It also causes uh, pupil dilation, can cause bladder sphincter contraction. We have alpha 2 receptors. Now they inhibit norepinephrine release. They reduce insulin release, and they reduce the sympathetic outflow. So from what you can see, alpha 1 wants to increase this sympathetic outflow, but alpha 2 wants to reduce this sympathetic outflow. We have beta 1. It increases the heart rate. It also increases the contractility of the heart muscles, as the myocardium. It also causes increased renin release from the kidney. Beta 2 receptors, they cause bronchial dilation. Beta 2 receptors are exactly what is targeted when you are treating bronchial asthma patients. Okay, it also causes vasodilation of muscles. So beta 2 blockers are drugs that are given to patients who have hypertension, because it's going to cause a vasodilation of the blood vessels. Now, when it causes vasodilation, there will be reduced systemic vascular resistance. Now, by reducing the resistance, you are indirectly reducing the blood pressure. It also causes uterine relaxation and increases glycogenolysis. Now we should have beta 3. Beta 3 is not so common, but it has specific function. Its specific function is lipolysis. So it's involved in the breaking down of fat and lipids to their simplest form, and also thermogenesis in fat. This has to do with breaking down of fat to produce heat for the body in order to maintain body temperature. Okay. Next group we have here, they are the dopamine receptors. Dopamine receptors, there are five. Now for the D1, they are involved in vasodilation in renal slash mesenteric vessels. The D2, they inhibit prolactin and modulate neurotransmission. So these ones are used as targets for antipsychotics. Now the D3 and D4, they are very similar. They have CNS function. They they affect the mood and your full body coordination. The D5 also involved in the CNS. It modulates adenylate cyclase enzyme. Yeah. The next we have here, they are the cholinergic receptors, which are also called the parasympathetic receptors. Now, it's divided into two. We have the muscarinic and the nicotinic. So we're taking the muscarinic first. Muscarinic are divided in from M1, M2, M3, M4, and M5. So there are five groups. For the M1, it's located in the CNS and the gastric glands. It's involved in coordination, like I said, CNS, and it increases gastric acid secretion. So for a patient with peptic ulcer, so you want to target this particular enzyme so as to reduce the level or the rates of gastric acid secretion. For M2 is located in the heart. Its function includes, it reduces the heart rate, it reduces the conduction, that is the SA node conduction, the AV node conduction, and for the entire conductive system of the heart. For M3, the M3 receptors, that is the muscarinic T receptors, they are found in the smooth muscles and the glands. So they are involved in bronchial constriction. They increases glandular secretions. That's different glands in the body, not a specific gland. It increases GI motility and it causes pupil constriction. For M4 and M5, they are mostly located in the CNS. They modulate dopamine and other neurotransmitters. So, if you observe a pattern, for most receptors, it is their first two or first three that are well explained and well researched, and their function are well defined. But for the like here for the M4 and M5 now, it's not so well defined. Research is still ongoing to find out their full function and purpose. The next we have here is that they call it the nicotinic receptors. So these nicotinic receptors, they still fall under cholinergic receptors, so they are parasympathetics. Now, for the nicotinic receptor, we have two groups. We have the NN and the NM. Now, the big N stands for nicotinic, while the small n stands for neuronal, while the small m stands for muscular. So the NM, that's the nicotinic neuronal receptors, they are located in the autonomic ganglia, also in the adrenal medulla, and they cause depolarization. Next we have here is the nicotinic muscular receptors. These ones, they are located in the neuromuscular junctions and they are involved in skeletal muscle contraction. You will hear of some drugs that they call them skeletal muscle blockers, neuronal muscular junction blockers, things like that. So they block this particular NM muscle receptors. So this NM, they are located in skeletal muscles only. They are not found in cardiac muscles. No. The next group we have here is the histamine receptors. Now, we have four of them. For H1, this is involved in allergy response. So it's involved in bronchoconstriction, vasodilation, pruritus. So just events that occur when the person is having an allergic reaction. For H2 receptors, this is involved in increasing the gastric acid secretion. H2 inhibits histamine release, while H4 is involved in inflammation, chemotaxis of immune cells. The next group we have is the serotonin receptors. They are called 5-HT. Now, the first one we have is 5-HT1. The 5-HT1 is still subdivided into subtypes from A, B, C, D, E, F, G, and H and F here. Okay, so under here we have CNS inhibition. So it's involved in CNS inhibition. It's involved in vasoconstriction, and it's a target for migraine drug. Migraine is a severe level of headache that someone has, that they usually give them some drugs that are called triptans, the sumatriptans, cleotriptans, so like that. So those particular drugs are going to act on these particular receptors. So that's basically the function of receptors. Receptors are sites on like the cell membrane that specific drug act on in order to produce a specific function. If there were no receptors, uh, drug won't be able to carry out specific function. So going back, next we have here is the 5-HT2. It's broken down into three subgroups: A, B, and C. Now this one causes vasoconstriction, platelets aggregation, smooth muscle contraction. For the 5-HT3, is involved in the vomiting reflex, located in the GI and the CNS, and is the target for anti-emetic like odoncentron. Now, odoncentron is an antiemetic drug. These are drugs that you give to people to prevent them from vomiting, to reduce the rate after they are vomiting or losing fluid, fear vomit. Yeah. Antiemetics can also be given when when patients have a cancer and they're going for their chemotherapy. The chemotherapeutic drugs are they cause make someone to feel not sick like vomiting. So they give anti-emetic drugs as part of the pre-medication to prevent vomiting in such patients. So back to here. So we have 5-HT4 receptors. These drugs they are involved in increasing the GI motility, and 5-HT5 to 7 not so well differentiated. They are involved in CNS regulation, sleep, and mood. Sorry. Now we have the GABA receptors. These are very important class of receptors. We have the GABA A. The GABA A are involved in inotropic chloride channels. So they carry out inhibitory, sedative, hypnotic functions. Generally speaking, GABA receptors are involved in inhibitory actions. Yeah. Okay. So and they are this GABA A, they are being acted up. Are acted upon by benzodiazepines and barbiturates. Yeah. So drugs that are used to treat um, sleep disorders, stuff like that. Now GABA B, they are involved in their metabotropic um, receptors. They are also inhibitory. They are used by baclofen. Now for the opioid receptors are basically broken down into three. We have three main opioid receptors. Now we have the mu receptors, that's the MU, the mu receptors. They are involved in analgesia, that is to help a person not to feel pain. Respiratory depression, they reduce the respiratory rates, make the entire respiratory system to relax. It causes euphoria, as a sense of excitement and overjoy, and it causes physical dependence. Physical dependence here means like when you start taking drugs or abusing drugs that act on the mu opioid receptors, for taking them for a long period of time can cause physical dependence, whereby you don't feel okay or you cannot function properly without continuous use of this drug. You are dependent on this drug in order to carry out your day-to-day activities. The next step we have here are the kappa receptors. So the kappa receptors are also involved in analgesia. They are also involved in dysphoria. Dysphoria is the sense of randomness, really feeling it, you're just scattered in your mind and everything. It also causes sedation. For the delta receptors, they also carry out analgesia and they use as antidepressants. So as you can see, all opioid receptors have one thing in common. They carry out analgesia, that is a condition whereby the person doesn't feel pain because he has taken a particular drug. So the last group of receptors we'll be looking at today are the glutamate receptors. Not so common, but they're important. Now the first group we have here is the inotropic glutamate receptors. They are ligand-gated ion channels. They mediate fast excitatory synaptic transmission. While the next group is metabotropic glutamate receptors. Now they are G protein coupled receptors. They mediate slow excitatory or modulative response. So for the inotropic, they are ligand-gated. Metabotropic, they are G protein coupled. The inotropic carry fast excitatory synaptic transmission, why the metabolism will carry out slow excitatory response. So with that, we've come to the end of this video. I hope you enjoyed it. Kindly follow for more videos like this, and please leave a good comment and subscribe. Thank you.